This is about the symptom we all came across in Alan's keynote while reading Cimicifuga, that is Actia racemosa. And the symptom is illusion as if a mouse was running under her chair. Now, what does the symptom mean, and how will the patient come to the clinic describing this? Does it mean that the patient actually has mice running under the chair and then they come and describe it? Or is it a state of delusion? Or the patient is getting hallucinations of creatures running under the chair? Well, it is neither of these. And it has a symbolic meaning. And mice under the chair refers to something very small, very petty or harmless, which does not seem to need immediate treatment or attention or management. So the attitude of the patient of this Cimicifuga patient who comes to you would be, say a patient comes to you with history of 4 months long cough, and now she has got the diagnosis from a doctor of it being TB or it being lung cancer or something very serious, and now she is very troubled and she is very bothered with it, and she has come to you seeking immediate help. But when you ask her about how the symptoms commenced and what she did when they started appearing, what treatment she sought, then she'll tell you that for a couple of initial months she thought that it was just dust, it was just allergies, or it was just viral infections, and she thought that they'll be manageable. So she did not seek help there. Then she did not see it as something harmful. So she was ignoring it, she was avoiding it, like everybody has cough once in a while, and she did not do anything about it then. Now all these things, dust, allergies, viral infections, what are these? These are mice under the chair. So she was seeing the problem that she had as something which was not harmful, which was something as harmless as mice under the chair. Now that she has been given a diagnosis, this illusion of those things being mice under the chair, of the cough being something very harmless, has gone. So we come to the second symptom of Cimicifuga, given again in Allen's: sensation as if a heavy black cloud had settled all over her and enveloped her head, so all is darkness and confusion. Now this is the current state of the patient after she has been given the diagnosis. So Cimicifuga can have both of these shades, one in history, one in the present, or one in present and the other in future. It basically means that the patient tries to ignore problems till they seem manageable, till they seem to not need her immediate attention. And once that delusion or that bubble is busted and she realizes that it is serious and she needs to seek care for it, then she's so depressed that this line, black cloud had settled all over her and enveloped, so all is darkness and confusion. Then she's very gloomy and she's very bothered and she has very less hopes of improvement. So these are the two shades of Cimicifuga, and this is what the symptom means.